In the beginning, I felt kind of lightheaded and also tired. So I ended up actually laying in my office because I felt like something's wrong. And I asked one of the co-workers, could you please do me a huge favor, get your car, I need to be rushed to the hospital and make sure that I'm okay.
The scary thing about a stroke is that it happens very sudden. It can happen out of the blue, and you may not know what kind of problem you have until you get seen in the emergency department. Yeah, so when you experience a stroke, that is usually a symptom that occurs suddenly, out of the blue, weakness on one side of your body, numbness, inability to speak or see or walk.
I ended up becoming paralyzed on the right side. I was kind of mute, I couldn't talk, I couldn't move, I couldn't do anything at all.
Mr. Zand was suffering from a basilar artery occlusion and an ischemic stroke of his brainstem due to that basilar artery occlusion. The basilar artery is one of the most important arteries in the body, arguably, as it supplies blood flow to the brainstem. Essentially, when the basilar artery is occluded, you're able to see everything that's going on around you, but you're unable to interact or do anything.
Yeah, comprehensive stroke care is a designation that we receive from the Joint Commission, and it's given to medical centers that prove to have a very comprehensive level of care for stroke patients, and that includes neurosurgical, endovascular, and medical care 24/7.
For every minute that you have essentially an occlusion like this, 2 million neurons die. So every minute counts. And without a comprehensive stroke center where we've worked on these processes of how we interact with other teams to make things more efficient in terms of time, it's essentially not as viable.
And right when I woke up, I was absolutely normal. I could move on the right side. I was much slower the first 2.5 weeks. And eventually, in my brain, in my head, that I want to get better. And that's what it takes, I think, for any stroke patient.
When you see him now, it's almost unbelievable, and it's only because he was airlifted to UC San Diego Health and that the embolectomy, the removal of the clot, was undertaken so fast that he has this outcome.
I ended up at the best facility, and I ended up getting the best care that I could have absolutely get. They literally saved me 100%. I tell everyone that I know, and I let everyone that I know, if you do feel any of these symptoms, if something does happen, you just wish, or I wish, you're close to UCSD, because they literally saved me.